Now, the Indian variant of coronavirus can spread like wildfire among those not vaccinated. That's according to the Health Secretary, Matt Hancock, who is urging everyone who is eligible for a vaccine to get one now.
And ministers are warning that vaccine refusers could be the principal threat to lifting the next stage of restrictions. So are people who refuse to get the jab putting everyone's freedoms at risk?
We're joined now by a member of Independent Sage, Dr. Zubaida Haque, who says it'll be unfair to lift lockdown now for those who haven't been vaccinated by choice or are still waiting on vaccines. And community leader Noreen, who feels we shouldn't be protecting those who are choosing not to take the vaccine. Let's come to you first, Dr. Haque. You say it's unfair for those that haven't yet had the vaccine, have chosen not to have the vaccine, but isn't it also unfair on those who have had the vaccine and are doing the right thing? They've approached it with collective responsibility. They now want their freedom and they want to get on with their lives.
It's not about unfairness, Adil. It's much more to do with public health safety. I mean, at the moment, we have approximately 2/3 of the population who are either partially vaccinated or not vaccinated at all. This isn't about vaccine hesitancy. And actually, I really want to take that up. Matt Hancock has suggested, the health secretary, has suggested that this is about vaccine hesitancy. But at the moment, his conclusions seem to be based on hospitalisations in Bolton of 18 people, of which a third have been vaccinated. Now, he's suggesting that of the 11 or 12, and I think it's approximately 11 or even less people or even fewer people, they didn't have their vaccine when they were offered. But we don't know why they didn't take up their vaccine. It may have been medical reasons, it may have been other reasons. So really, Adil, this whole notion that at the moment everyone's freedom is threatened because of vaccine hesitancy groups is absolute nonsense. Really, at the moment, the main threat at the moment is that this virus, this variant, the B1617.2 Indian variant, is highly transmissible. It's 50% more transmissible than the Kent variant. It is rapidly spreading across the country. We have over 40 areas now that now have this variant, and we know that places like Bradford, Bolton and Blackburn now have this variant as the dominant variant.
And we know how transmissible it is, but surely if you do get the vaccine, you are less likely to put pressure on the NHS because it will protect us more against hospitalisation and death, because there are smaller numbers in hospital suffering with the consequences who have been vaccinated than who haven't been.
Vaccines will certainly help to reduce severe disease. There's no question. And I think myself and Independent Sage, we have been saying continuously, please take the vaccine. It will help you from severe disease. It will protect you from severe disease. That's really fundamental. But at the moment, there are some things that we still don't know about this variant. And one of the main things we don't know is to what extent it can still escape the vaccines. And we need to find that out. And what the government should have done was to stall this stage of the roadmap, particularly because we didn't pass test 4. Test 4 of the government's roadmap said that if we think that there's any further risk from new variants of concern, we should stall.
Okay.
And they completely ignored that and gone ahead.
All right, Noreen Khan, this isn't actually about vaccine hesitancy. We should have paused the lockdown restrictions easing anyway, because for whatever reason, lots of people haven't been vaccinated. And I mean, you know, for instance, I've only had one dose of the vaccine. Luckily, my second dose has been brought forward. But there are plenty of people, younger people, who haven't been vaccinated at all. And that's not because they're hesitant.
That's right, Susanna. Good morning. So I think it's not even just about the vaccine anymore. From a community's perspective, what we are hearing loud and clear is that there isn't enough accountability coming from the government, and communities are becoming very aware, Susanna, of the risk to populations that now is being posed. So if we take it right back to the stem of the Indian variant, okay, why was India, the borders, were not closed earlier on? Why were they still allowed to trade with Britain? Britain. We know that the trade, convoy, the delegation that came back, there was 2 people on that aeroplane that came through. Where were the checks and balances back then? And communities are now aware of this. Because of a trade deal between India and Britain, their borders were kept open. Whether it's geopolitics and Bangladesh and Pakistan, they were shut down very early. Even though
we understand, and
so
of course
communities are understanding, Susanna.
But what impact does that have on vaccine take-up?
Because of the exact frustrations, Susanna, those exact frustrations are now stemming down. Communities are not dumb. They're aware that this is happening. And if the variant, if we know that the vaccine was going to help this variant for over a long period of time, why were the borders not shut earlier? And if we don't know that this vaccine is helping against this variant, then that's where the hesitancy is coming from. So it's going to take a longer period of time before we start to see the effects of whether this is happening. More and more media coming from the South Asian countries is helping some, cohorts of communities that they're taking up the vaccine more and more. But to start, it's a constant racialization of the lockdown. Local lockdowns don't work. If they worked in the first place, then we wouldn't be in this situation. I think maybe a harsher method of a national lockdown will be needed just to stop everything. But that's our part. That's the business's part of doing it. Where is the accountability from the government to shut the borders? We're an island. We could have protected ourselves. Instead of keep locking us down and allowing other variants to come into this country and spread like wildfire while keeping us, behind closed doors is not the answer. We should have shut the borders earlier. Our intelligence services should have picked up on this, much earlier. And if that was the case, then we should have protected ourselves.
But Noreen, you just to clarify, you are though agreeing that the collective responsibility, the personal responsibility on us as people and citizens of this country is to go and have the vaccine or not? I mean, regardless of what the government does, we're talking about vaccines here. It is up to us, if we want to protect ourselves and our family members, is to go and have the vaccine, regardless of what the government decides to do, right?
No doubt about it. I'm the biggest advocate. My previous times on your show has been about our COVID leadership programme. Instrumentally, we are helping in Bradford, pushing the message forward. We know we've helped with the increase and uptake rate of the vaccines. I am so pro-vaccine, it's unbelievable. But it's also understanding that we cannot completely, railroad everyone into taking it if there are hesitancies.
But I'm not sure, but I'm not sure, Noreen. I have to be honest, and I've worked really tirelessly on this, and as people know, on a Hesitancy campaign, and I'm not sure whether it's going to be beneficial to really put all the onus on the government and blame the government and start pointing fingers at others. It's got to be about personal. And what I found is having conversations with, if I can just finish, by having conversations with the community and hearing their concerns, but ultimately the message must be go and have the vaccine. And I think what Matt Hancock has probably done here, and I buy what Zubaida Haque is saying, that perhaps it's only 18 people, but he is, and probably quite smartly, using this moment just encourage people that actually there is one way through this, and that is to have the vaccine. It's not the only way, but it is one way.
It is not. I'm really sorry to interrupt, but it is not the only way. The entire.
I didn't say that. I said it's one way. I did say it's one way, not the only way, but it is one way. And I can't understand why we would not encourage personal responsibility.
The problem is, Adil. The problem is, at the moment, vaccine hesitancy is being used as a red herring. I think Noreen raises some very legitimate points, which is, look, at the moment, we've got this vaccination program. Absolutely, everybody should take vaccinations because it reduces severe disease and it will take the pressure off NHS. But there is a key issue here, which is how is the government going to stop the spread of this variant? Now, it takes a while to roll out this vaccine. We've still got millions and millions of people who haven't had either the second dose or any dose at all. It's going to take a couple of months. We can't wait a couple of months. So I think Noreen raises a very important point, which is what else is the government doing? Now, at the moment, she's absolutely right. We have a leaky border policy. The traffic light red list system won't work. It's completely ineffective. It allowed 20,000 travellers from India to come in between the time it was identified and between the time it became identified as a variant of concern. And on top of that, we have a dysfunctional, we have a test and trace system that does not work.
Dr. Haque, I don't think... Look, Susanna and I spoke to Kwasi Kwarteng yesterday. We'll be speaking to George Eustace, a minister, later. And mark my words, we do question them on what's going on with the borders, what's happening with flights coming in and out. Why were they so late to put India on the red list? We'll deal with that with the government. But in this moment, we're talking about personal responsibility, and I'm really puzzled as to why the message from you isn't, yes, we can deal with the government and we'll deal with that, but as human beings, the personal what message did you say to human beings and personal people to go and have the vaccine? That is the thing I'm slightly puzzled by.
This isn't about blame, Adil. This isn't about blame. Can I just say that with vaccine hesitancy, there are a wide variety of reasons that people are hesitant and nervous about taking up the vaccine. The research has shown that it is about anxieties and concerns, you know, ranging from side effects to whether the vaccine will work, to whether it will affect fertility, to people having underlying illnesses and wondering, you know, will it affect that? And then, of course, there are issues with some communities about long-term distrust. I mean, we have to remember that Black and ethnic minority groups, especially Black and Asian groups, have been disproportionately likely to die from this virus, and yet the government has not done anything at all to mitigate that risk in that pandemic. So there are issues about trust, and we need to think about that as well. The most important thing with vaccine hesitancy is not to blame, is not to stigmatise, is not to point the finger, but to ask those communities what are their concerns and help them to take up the vaccine.
I hope there's a lot of, I hope there's a lot of those communities feel reassured. I mean, on this programme, Dr. Hillary's gone out of his way to reassure people on all of those concerns. The point is, we know that vaccinations will help mitigate your risk of being in hospital and dying of this virus, and protecting the NHS and living alongside certain amounts of the virus is vitally important. We do need to get vaccinated. I mean, you know, it's not a question of blame, but it is you know, at the moment, it's our route out, isn't it?
And just two quick further points on that. Is, you know, I don't think it's necessarily about hesitancy in the way you've just described, but also it's about deprivation, and we're aware of that. Some of these people in these areas, they just feel like they don't have access to the vaccine. They've got very difficult lives. They can't go to the vaccination centre. And I think what they've proven in Bolton, which I think is fantastic, putting that vaccine bus, and the people are queuing up. And the other thing to point out, this is not just ethnic minorities. We had Ingrid Tarrant here, very well-known person with a high profile here on the show yesterday, you know, in her 60s, a white lady who said she is still not having the vaccine, unsure of it. So this isn't just an ethnic minority issue, it's an issue for all of us.
I also mention, you know, I mean, Susanna, you're absolutely right in terms of those reassurance messages. But I think we've banged the drum of telling people, you know, educating communities and telling them to go and follow the guidelines, you know, wash your hands, all of that. We're kind of past that stage now where we're hoping that everyone has at least got that message. But now it's also about understanding and supporting those communities that we are hearing what you're saying, and those who are in a position to be able to try and get our message to the top. That's what we're trying to say, that accountability is a three-way stream. It's the government, businesses and communities working together. It's not just about communities.
Thanks very much, Dr. Zubaida Haque. Thank you for joining us. And Noreen Khan, it's been great to speak to, from my point of view, to speak to Mrs. Khan, the community leader. It's great. So I did that for many years on the TV as Mr. Khan. But there you go. Lovely. Thank you very much.